Let me introduce, we also have with us Ravi Bhatnagar, Director External Affairs and Partnerships, SOA Reckitt, and we have Dr. Komal Goswami, Chief of Party, Plan India. So we're going to be talking about a self-care kit, and this is what this campaign talks about. Creating self-care is one of the main things of our program. And Dr. Komal, what I would like to ask you, tell us about this, this creation, or why is this self-care kit important?
Okay. So Ambika, you know that we have been doing this nutrition program since 2018, and we have realized that we need to start young, not just with the under 5 kids, but with the young mothers also. India is a culture of diversity. It's like we have to reach out to last mile population. And as Bhumi was just saying, talking about agency, lot of our women who are in rural areas or in tribal areas, they do not know the concept of agency. As soon as they are married, they are, as Bhumi was saying, forced upon taking the additional responsibilities, right? They do not have time to take care of themselves, to talk about, mental health. So mental health is something, postpartum depression is something that the logic is very much adaptable and distinct to the urban population, but not for rural or tribal women. So a lot of other things such as hand hygiene, overall hygiene, menstrual hygiene, talking about, ensuring that not just the family is fed well, herself, she and herself is also fed well. It's all about starting very young. When we talk about, that the mother is a high-risk pregnant woman, how does a mother become a high-risk pregnant woman? The mother become a high-risk pregnant woman because she is anemic since ages, maybe when she was just a girl or adolescent, right? And there are no such facility or no such, person in the family who knows about it and who can guide the mothers. So that's how we devised the self-care kit, which will not just take care of the under 5 kids and prevent them from diarrhea and pneumonia, but also ensure that mother have that agency and mother takes care of herself so that she becomes more enabled to take care of the kid and the family.
Yeah. Absolutely. So let's see what the kit has. Request you to please unveil that. In fact, जो भी ये बता रहे थे, going into the tribal areas, Komal and I traveled about a few months ago to the Siddhi community. Jambur में गए थे, where we met the community. So if you all could please unveil. So let's see what the kit has. And Ravi, if you could also tell us why are these things important. So please.
Yeah. So interestingly, Ambika, this all came from our work, what we have been doing in Amravati and Nandurbar. And I remember our, season 6, where with Mr. Fadnavis, who's Deputy CM of Maharashtra, we made a commitment. And we said, we are going to make sure the tribal kids will be taken care of. After delivering the program successfully with Plan India, we thought, now it's the time to expand the program to various states in India. So now the program is moving from Maharashtra to Gujarat as well as to Rajasthan. And the program aims to reach 10 million moms. The program, aims to reach 1 million under 5 kids. And by the virtue of this program, there are a lot of conversations with the WHO. When they were releasing the self-care report for South of Asia, I was one of the members in the expert committees for the same. The program, the work what we have been doing on the Dettol Banega Swasth India gave us the platform to position and to actually tell what is working in India, especially in the rural and the last mile. And now this, this kit is being divided into 2 parts largely. Yeah. One part is for the mothers and the second part is for the kids. So for the mothers, this kit has iron and folic acid tablets, it has vitamin C, it has sanitizers, it has a baby blanket, it has a Dettol liquid soap. For the kids, it's taking care of the diarrhea and pneumonia both. It has the ORS sachets, zinc tablets, thermometers, soaps, amoxicillin tablets, surgical gloves, and the pulse oximeter. Basically, we would love to have these kids, placed in the wellness centers, in the Asha centers, in the Anganwadi centers. Also, we are heavily training now the last mile, delivery for this program, because still in India, the pneumonia cases, diarrhea cases are still very high. And world talks about, 3 countries. One is Bangladesh, second is India. We are neighbors, but the indicators are very different. We really want to move up. We really want to support all the 100+ aspirational districts what India has. And this is our firm commitment, along with Plan India. We're going to take it to the last mile.
Thank you so much.
Thank
Much
you.
for explaining that well. And I think, you know, all these things are very easy, doable, like having an iron, folic acid, which every pregnant woman needs to have. But, you know, the importance of having a vitamin C tablet with it for the absorption. So I think creating awareness for the mother and then breaking the intergenerational cycle that only if a mother is healthy, will the child be healthy. So I think that's what it's important.
Like even if you look at urban cities, if my mother is not well, she will completely ignore herself because that is societal conditioning. है ना, उन्हें सिर्फ लगता है कि नहीं, जब तक वो एकदम till they don't reach the tip of it, they will not do anything about it. Most times they feel embarrassed, they feel ashamed, and also ना हमें बताया गया कि हम बहुत strong हैं, हम दर्द ले सकते हैं. Like even if you think of period pain that women have to go through, you know, most times it is just dismissed. And only if you go through it do you understand. आपने और मैंने एक बार इस बारे में बात की थी सर, अगर आपको याद हो. It is just completely dismissed because we are just taught to take the pain. And if you don't take it, you are completely dismissed saying कि बाकी लोग देखो. But none of us should endure this pain.